Thank you so much, Senator Frist. I think that was exactly the energy we need this moment as we think about broadening our coalition. So we're going to move into our next session that was organized by the American Public Health Association. This session is on the extreme heat, local and state opportunities. Our speakers for the session are Barrak Alahmad, a research fellow at the Harvard T.H. Chan School of Public Health, Meghan Richards with the Neighborhood Resilience Program and the manager there for the East Side Community Network, Bruce Lippy, the president of the Lippy Group, and Rebecca Shasanmi Ellis, assistant professor at Georgetown University School of Nursing. So if we could welcome our speakers, and I think we have a few folks that are online today.
We welcome you to our session on extreme heat. My name is Rebecca Shasanmi Ellis, and our session is really an opening for a conversation around the prime examples of how folks just like you who are in the audience and myself are working on ways to mitigate the impact of extreme climate events on our local and global populations. As we've seen recently with shifts in government, become shifts in focus. The previous administration took historic actions to address the climate crisis and help communities across the United States become more resilient to climate's impact, such as extreme heat. And the present administration has taken some clear steps towards actually tearing down some of those things that many of us have actively been working on, such as protections through EPA, ATSDR, and even reporting mechanisms through the CDC, the Department of Health and Human Services, education, and also NIH funding for environmental research. We are facing shifts in legislative and federal cycles. So it brings forward for us critical questions that cause us to face what will the future look like. How do we align our efforts to protect communities, sacred lands, ecosystems, and also infrastructure that nurtures stewardship and belonging now and into the future regarding extreme climate and its impact on our populations? This session brings to light and highlights some of what we experienced just this past summer. In summer of 2024, over 265 million people in the United States experienced record-breaking heat waves. Heat-related deaths increased, and also warmer temperatures associated with increased risks in hospitalizations from heart disease, respiratory complications, kidney damage, preterm birth, and also mental health impacts. Public health workers and health workers who are working on the front lines are treating patients with exposure to extreme heat, with elevated health risks of outdoor workers, children, and older adults, and those who experience barriers to accessing cooling or healthcare, such as those living in low-resource communities, both rural and also urban. Our session hopes to highlight that extreme weather events continue to impact and cause loss. This aligns across multiple focus areas, as our panelists will share with you, coming from university partnered research, coming from community-based organizations, as well as state-led and coordinated initiatives. We realize that our attention to collective action, as well as durable gains occurring at these levels of state, university, local, and community action. These examples will show us how these experts have organized, mobilized, and collaborated on areas regarding extreme heat. As was opened up, our speakers will be Dr. Barrak Alahmad, Ms. Meghan Richards, and Dr. Bruce Lippy. They will help to frame for us a conversation that's really at the crossroads regarding how we'll continue to advocate for climate solutions that meet the needs of all people and ecosystems. as we realize that social determinants of health and how we construct the conversations around what communities are affected. With 265 million Americans affected, that means it's not just a city it's not just a city aspect in terms of extreme climate. But we need to examine and call out the absence of federal policies, the absence of federal and state and even local political will to support climate, extreme climate, and health, climate, and extreme heat related impact. My hope is that as we explore these topics around with our state and local partners, we'll begin to think about what are the practices that can be scaled up in our own communities. How can we continue to advocate for the allocation and also generation of resources that will fill the gaps that ultimately are being exacerbated with shifts in political will. The session speakers will offer their experience and analysis of the intersection between policy and practices and implementation, and talk about how it's shifted the impact of extreme heat on occupational health workers and also communities. This session, our hope, will amplify the opportunities for durable equity and renewed advocacy in response to climate crisis, emphasizing where we can act collectively rather than just alone. Thank you all so much for being here in this session, and our speakers will give us their talking points and their experiences from their perspectives in research and community and also at the state level. And then we'll open it up for questions from that we've prepared for our panel, and then open it up to you all to ask your questions. Please remember to use your CVent app and go to the live Q&A and add your questions there, and we will answer the questions live during our session. Thank you all so much, and I'll hand it off to Dr. Lippy.
Thank you all. Good morning. Let me see if I can get my slides. There we are. Okay, so that works. Well, thank you so much for inviting me, and thank you for the American Public Health Association as well. I come from academia. I come from the Harvard T.H. Chan School of Public Health. And today I picked one group that I believe is the most affected by extreme heat. And these are the workers, and outdoor workers in specific. And I know in the program, there will be other people that will talk about different subgroups. So I decided to show you where the research is right now and what are the pushbacks against it, and how can our research push this forward. And I will start with saying I'm also a medical doctor, and I quit medicine. And there isn't a single heat stroke death that isn't preventable. Yeah. 100%. It's not related to a worker that is a smoker or this worker drinks alcohol. A heat stroke death is preventable. If your body is overheating, if you're ejected from that work site and cool down, that death is 100% averted. Now, what are the ways that we can stop the bodies of workers being overheated? And there are absolutely 3 small things, and I put a 4th one right in here. These are rests, shade, water, and hydration. It's not rocket science. These are simple things that can be implemented. And we'll start with sanitation. That's in many remote places. In construction, you need to provide this also for women. And then with water, it's easy to also give and provide accessible to hydration. And shade as well. You can have some structures that provide shade. But the problem that has always hit the science on the head is, when do you give the rests, and for how long are the rests? And is it going to affect my productivity as an employer? And I'll show you an example from the science. So this is the Adelante initiative. This is from La Isla Network, a nonprofit that did work with local communities and sugar farms in Nicaragua for 10 years, from 2012 until 2022, the data that is presented here, but the cohort is still being followed. And I'll show you how they started implementing their interventions in 2015-16. And one thing that I'm going to bring to your attention, look at this yellow line. And that yellow line, it shows you the amount of hours worked by a worker in the farms every day. And it used to be 8 hours without rests. These are all the workers that keep cutting all these the sugar in the sugar cane. And then when the rests were implemented, and it was implemented in a scientific way, looking at the wet bulb globe temperature, the environmental conditions, and that was implemented, the workers worked less hours. So that is the concern that most of the employers would push back and say, well, you're affecting my productivity. But in agriculture, and these workers are piece rate workers, which means that you have a very objective measure of productivity. And that is, come the end of the day, wherever grapes you collected on a box, you put it on a scale, and then I'll know exactly on that scale how much productivity was there. And look at the data. The data shows that the workers, actually, the yellow line, although they worked less, but with the years, they became more productive. They're producing more tons per hour, and the overall tonnage that is being collected in the farm remained almost the same. It actually increased. So that shows that when you give rests for workers at the right time, they will work less, but they will be more productive. And now we can show this. There is data that supports increased productivity with increased interventions. So it's not going to lower this. And I know there will be other pushbacks again, like construction is difficult to measure objective productivity. But this is very objective. There is no way that we cannot get this. This is one of the most beautiful graphs that I could ever look at.
Yeah.
And it shows this, and it's so nice. And that's all the work that has been done by La Isla Network and others that I work very closely with. Unfortunately, most of their work now is being frozen with the current cuts to the federal funds. But that shows you that productivity works. It increases when you provide rest. And think of it as if you go to the gym, right? If you do the HIIT training, which is like you take a rest, you recover, and then you come back faster, you come back better, you come back more focused. And that's what we want to see. This is where you implement safety measures and at the same time, productive measures. But that's rest, water, and shade. We can implement other solutions. For example, engineering solutions. And this is part of the work that we're working with the American Public Health Association with another nonprofit called the Smart Surfaces Coalition. Our surfaces can be actually smart. We can have greening, reflective surfaces, shade, cool roofs. And these things will also improve the productivity of workers. We worked very closely with the San Francisco Airport. They gave us detailed mapping of their campus, all the roofs in there, all the surfaces, and then we modeled for them at a very small scale, showing that if they implement these smart surfaces, the greening, the reflection of the surfaces, the shade, the cool roofs, they could gain somewhere between 5 to 7 to 9 hours, depending on how much they can get per worker per month of hours gained in workers' productivity. So that's the engineering solutions that we can do. And we can go sci-fi as well. There are wearable devices now. I put Lionel Messi in there. Do you think athletics don't measure to the minute the athletic performance of athletes. We got the Paris Olympics that was there, it was in the summer, and all the coaches, they know this. They measure this, and they can collect data down to the minute. And we've had now experiences with this data. So that's one work that is being done. Now we can measure sweat at 1 minute resolution. So I can know how much you're sweating right now. I can tell you how much you need to rehydrate. And we can take this to the next level, which is we have a safety team that looks at the data. You've got the workers putting some wearable devices on their forearms, and that will give them a vibration, and that will tell them, well, this is you're dehydrated, you need to stop, you need to process. So I gave you 3 examples. Basic rest and shade and water increases productivity. And also engineering solutions, nature-based solutions in a workplace like outdoor workers in San Francisco Airport. It's a very busy airport. It gets hot, and these workers are in the tarmac, which is also dark and absorbs a lot of heat. And that we showed if you put some of these smart surfaces that can improve workers' productivity. And then now we can also take this to the next level. So I will stop here and pass it to my other friends. Thank you.
Good morning. My name is Megan Richards, and I'm from Detroit, Michigan. So every time I go somewhere, I always say, "What up, though?" Yeah. All right. So I'm here to present on our grassroots approach to high heat in Detroit. And this will include, well, you'll see. There we go. All right. So understanding high heat in Detroit. So we're facing quite a few climate issues in Detroit, and one in particular is high heat. And heat is really a tricky thing for us. So I'm just going to paint a social picture for you really quickly. A lot of Detroiters are second and third generationers, and our families are from down south. So we love the heat. We say that, hey, I'm not made for this cold. I love warm. I'd rather sweat bullets. I'm just glad it's not 30 degrees outside. So we have a really deep disdain for the cold there. Like, we talk about it every year like we never experienced it. I promise we do. And also Detroit is a very familial place. So when it's summertime, it's like the time that we kind of come alive. We're outside, we make memories. That's just like our time to shine. But unfortunately, due to worsening climate conditions, the heat is becoming increasingly dangerous for us. And one of the issues that is exacerbated by that is, well, exacerbates the heat, is the poor air quality in Detroit. So this illustrates here the Stoudemire Community Hub is where ECN is located at. And then we have 2 Stellantis factories that is formerly Chrysler right there. And then we have schools. We have another GM factory there, and this is all neighborhoods. And this is where I live, right over here. And I can say that since living in that area in the last 4 years, I've been sicker than I've ever been in my life. No, it's okay. I'm sorry. I know you guys are healthcare professionals, so you really care. But yeah, so I started to like track certain things like in my blood work and certain things that are still within normal numbers, but still very high. It illustrates like things that I should look out for cancer have just skyrocketed. And that's just something that's very normal, unfortunately, over in that area. And I don't think that's a coincidence. So a very similar map, this is just illustrating the heat. You can see it's kind of like, well, let me say that. The air pollution and then the high heat. So put those maps on top of each other, and this is where we're having a real big issue at. Yeah, it's just really upsetting because as you can see where the areas where it's really extra red, those also happen to be like red line areas. So they lack tree canopy, they're redlined, and then they're being affected by the poor air quality. So I'd also like to highlight the need for tree equity as well. Okay, so also, I'm going to get to some good stuff, but I'm just letting you guys know all the bad stuff first. Many of the homes in Detroit are older, like very old, so they don't have HVAC systems. combined with also the misconceptions about heat, the limited heat education, and the mislabeling of heat-related illnesses. So like not calling it what it is, like you said, that has created just a more even serious issue. ECN does have a home repair program in partnership with DTE. We provide residents with energy efficient upgrades that include furnaces, HVAC systems, standalone AC units, hot water heaters, insulation and windows. So that does help some. However, as shown on this slide, these upgrades not only reduce harm and promote green energy, but also they help offset rising energy costs, because this is a whole nother issue. So when I was making this presentation, I thought like, is there a way to show you guys like without just, so I just typed in DTE on my Facebook, and this is what popped up. Everybody is so upset, myself included. Our bills, I have a high efficiency unit in my home too, like all my stuff is high efficiency, and my bill is still considerably higher this year. So some people are actually calling for an investigation of DTE. But anyway, in Detroit, heat is seen as a necessity, but AC is seen as a luxury. That's literally how we're raised. Like, oh, do you have an AC? Okay, well, I'll cut mine on today, or I'll cut it on when it gets really, really hot, and we can go to your house or something like that. But it's not like use AC no matter what when it's hot. It's just turn the fan on, circulate the air. It's not seen as a need. So what are we doing about it? So we have started the Resilient Eastside initiative called the REI. The REI is comprised of community orgs, and the thing about these community orgs, they were already doing the work. So they're trusted places and spaces. And so that was really important to us, because we did not want to just like get behind the move of building up brand new places and telling people just to come to these cold, barren, technologically advanced buildings. So yes, I'll show you the, ta-da, we're so proud of this. So these orgs, one is a city building, but we are in partnership with them as well. And our other partner is Elevate. And our goal is to have a hub within 15 minutes walking distance of every resident on the southeast side. Moving to my notes. Yes, so these hubs all do different things, and that's one of the key things too, but they also are cooling centers. They offer education on climate safety. They host workshops on climate issues, and really it's about the education. But just to give you a little idea of what they do, we have workforce development, a couple grocery stores, youth programming. One is even a community coffee shop and laundromat. We have food sovereignty programs. Some of them are urban, a lot of them actually are urban gardeners, and even some faith-based orgs. So what we're doing at ECN and kind of spreading out to the hubs, to the other hubs to do also, is making high heat days social events. So this past summer, we kind of like piloted some programs. And so we recognize that many homes are unsafe due to the lack of AC and poor indoor air quality. So like I said, we made high heat day social events. So our programming fosters fun, welcoming spaces, and we make sure to still build on community connections. And the events include ice cream socials, pizza parties, movie screenings, family-friendly activities, where we focus on education, empowerment, and equipping residents with the knowledge to advocate for themselves. Also, we'll do like workshops on how to make homemade air purifiers, where you kind of like, you put like you guys probably know about this already, okay. Oh, okay. So you just take like a box fan and you take a furnace filter and you seal it up really, really, really well around all the edges. And you can there's like a couple different ways you can make it depending on how advanced you want it to be, but it does make a difference in the room that you're in, because we also have like a community air monitoring program where we have people carry like portable air monitors so they could just see, how the air quality was around them. And a couple of them came back and actually told us when they used that homemade air filter, they noticed a difference in the air quality in the room they were in. So we know that air purifiers can be really expensive. So that is a way to kind of mitigate that. We also are working with our city's health department, MDHHS, and we also just got chosen as a site for healthcare without harm. So we're really excited about that. Oh, sorry, it's my time. Okay. Okay, so what can we do about this moving forward? So for true impact to be made and felt, we need to have collaboration across the board with all agencies working together and focus on education, cultural norm shifts, and actual climate adaptation strategies to be implemented. Thank you.
Well, greetings. I'm so excited to speak here today. This is terrific. I said to my wife, honey, in your wildest dreams, did you ever see me speaking at the preeminent conference on climate change? And she said, sweetheart, you're an industrial hygienist. You are never in my wildest dreams. So, I'm sorry, how many have heard of industrial hygiene? Wow. For those few who haven't, our profession led all others in having the least number of members with dates for the senior prom in high school. Large animal taxidermists were right behind us. Well, we do measurements of contaminants in workplaces, and I've enjoyed it. I fell into it, but I've enjoyed this profession. So let me see if I can figure this out. A little bit of background. I'm speaking about the Maryland standard that we just put in place for heat stress. When I started working for Maryland OSHA, that's a state plan in 1978, there were 3 workers that died of heat stroke. 2 of them worked in this plant. This is Bethlehem Steel. 25,000 people worked there. They had 13 fatalities over an 18-month period. And these 2 workers, MOSH, Maryland OSHA, cited Bethlehem Steel under what's called the, 5A1. That's a general duty clause. It says, it's an OSHA standard. It says, all employers must offer a place free of recognized hazards. And of course, heat has always been a recognized hazard. So most cited them, but this was a calamity waiting to happen. It was a hot day in August, I believe. These folks are working around molten steel. The co-workers noted that one of these unconscious steel workers wasn't sweating. Now, there's a lot of physicians in this audience. You know that's a classic sign of heat stroke. These folks did not know that because they weren't trained. So they wrapped this individual in a blanket to get them to sweat. Yeah. The fine that they got from Maryland OSHA, Beth Steel, millions and millions of dollars in sales, of course, was several $100. They fought it with the best lawyers in Baltimore, went back and forth. I don't even know how it ended up. But the good news is the plant is now gone. The steel mill is gone. In its place is a plant that fabricates wind turbines. Yeah. For some folks, let's say Donald Trump and Don Quixote, you can call them windmills, but wind turbines. The problem is the calamities continue. This young man is Ron Silver. He was a 36-year-old guy working on a garbage truck in Baltimore. And he was off the truck to try to get water, went to a door and knocked on it and collapsed at this doorstep. The heat index was 103 degrees Fahrenheit that day. That was 2 months before Maryland OSHA put their heat stress standard into effect, which arguably really would have saved this man's life. So my first lesson is, and we heard this yesterday, I thought very nicely, use stories and show the human dimension of the problem. And this man left 5 children behind, by the way. So part of my message is the states can be great engines of innovation. These are the states that now have a heat regulation in place, and I won't go over them, but if your state doesn't have one, you should ask why. There's lots of things going on here. The National Institute for Occupational Safety and Health in 2016 put out this guidance document about heat and hot environments. It's like the Bible as far as my occupation is concerned, because so much is built on that. So many of the state standards and consensus standards have used this as guidance. And here is a guidance for construction. This is ANSI standard. It's ASSP, American Society of Safety Professionals. I worked on this committee, the A10 committee. This is a consensus guidance document that's really quite good for construction, which is different. And this is my second lesson. And that is, we should rely on consensus documents when regulations aren't in place. A little bit about history in Maryland. This standard we put in place was really made by folks like you, pushing. They pushed for legislation and then for regulation. 2020, Maryland legislature passed a bill directing Maryland OSHA to establish a rule by October 1st, 2022. That came about because two of my colleagues, also sort of retired safety and health professionals, went to one delegate, Delegate Charcuti in Annapolis, and said, we need a heat stress regulation. And so she invited folks from Maryland OSHA to come and meet with these folks. They declined. So my pals pushed to get a bill, and this is the bill. It said, you will write a regulation. MOSHA drafted a bill, and a regulation in 2022, and we testified. But here's my lesson. Get to know your local politicians, regulators, and lobbyists. What a big difference that makes. The draft standard that MOSHA put in place was very flawed, and a bunch of us testified to the fact that it really was missing things. One of the things that was missing, and I won't go over this whole list, it didn't require employers to have a written program. So if an inspector went to their site and asked, where's your program? The employer could say, got it right here. So, that was unacceptable. They also really had no specificity about rest breaks or acclimatization, which I'll talk about. However, Maryland OSHA listened, and they put through a new version. It was much better, and it actually became a regulation in September of 2024. And to MOSHA's credit, they held stakeholder meetings all around the state. And there's the invitation. There's also Zoom. You could do Zoom. On the left, you'll see my little invitation I've put in to speak. I spoke at Hunt Valley, Maryland. So they did things right. The University of Maryland and a bunch of us got together, and we put together a promotional workshop. You can see Rising to the Challenge, the new Maryland heat illness prevention standard. So the reason we did that is no one knew about this regulation. So here's my other lesson. Don't expect a regulation to make a difference if the regulated community doesn't know about it, right? So we pushed, but the other thing is we invited the regulators to come in. We were cordial. There's no reason to be acrimonious. And they really were on board with this. And you can see the co-sponsors. Someone asked me about the role of unions. They were so important to this effort. The public asked me, and the laborers, they were a driving force, which is really important. The Maryland regulation requires a written prevention and management plan, and also monitoring heat index, which is temperature and relative humidity, throughout the work shift. And my gentleman friend here showed you some devices from the medical side, and this is stuff that's available for free. You can download these apps from NIOSH and from American Industrial Hygiene Association, and they're very easy to read. You can see caution, warning, and danger. Most of the regulations in place have 80 degrees Fahrenheit effective temperature as a cutoff. Acclimatization is an element of all state regulations. What's the rationale for that? Well, here's one. Over 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so important. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so importantly. 70% of heat-related deaths occur during a worker's first week on the job. And that's an astounding figure, and it's so importantly. The most regulation also, as was pointed out, requires shade, water, and breaks. I worked construction before OSHA, in fact. There was no OSHA. And this device like that was not on a job site. This is a nifty device you can pick up with a forklift, take it right over. They're laying sewer pipe here. That's what I did too. I was darn good at it. But it makes a huge difference just to provide shade. And this regulation requires you to do that, which is important. Also, like almost all of the state regs, most requires employers to provide drinking water at no cost to the worker, not bottles of Perrier for $5. Free, and it should be potable, that's tasteful and cool. So that's also just a very crucial piece. Finally, the regulation, as with most regulations, requires emergency response planning. We all know, folks in this audience, heat stroke is a medical emergency if it's not dealt with quickly. The workers that I talked about from Bethlehem Steel, they took them to the closest hospital and put them in a tub of ice water. And they sat in that tub for 40 minutes or something to try to get their body temperature down because it's not coming back down on its own. So having this planning, knowing where the nearest hospital is on a job site is very important. So I'll stop there. I think we're going to take questions. Here's my contact information. I do want to thank three people, Gavin West, Rosemary Sokas, and Christina Campbell for helping me with this presentation. And so I thank you for your time.
Thank you so much, panelists. And so now we'll move into our question time. We will do a couple of pre-prepared questions, and then I've been seeing the questions from our audience coming through on the app, so we will get to those as well with our time remaining. In your presentations, you all shared about what was happening with state level leadership, innovative research on heat adaptation, protection for workers, and also community-led resilience efforts. What are some of the opportunities for these sectors, policy, academia, community organizations, to work together more effectively? And we can have any one of you start who would like.
Oops, you're on a roll.
Well, I would say it takes some core organization to set the spark, to reach out to others that are like-minded and say, like we did in Maryland, we really need a state regulation for heat. OSHA still does not have one, federal OSHA, and there's a draft which received, I think, 58,000 comments. But the chance of that draft making it through during this administration is like me winning an Olympic in breakdancing. So it's not going to. No, seriously.
You're good at that.
I'm pretty good. I'm tall, but.
I'll take my chances.
But seriously, you got to get that core together, that critical mass, and it can be very different groups. You sit down with folks that have not much in common with you, except they want to see this happen, one thing. So that would be my advice.
Sure. I think that along with what Bruce said, getting core orgs together, in my mind also, it would definitely be using like the data that you shared earlier, because like that grabs people's it just grabs their attention when you can have clear, concise numbers, and then you have community orgs kind of like disperse that information out to the people. So that's something that we would do. We would want to partner with healthcare professionals to help compile data, put it in like a way that is palatable, I guess you could say, and share it out with the community. And sometimes getting people upset is what like incites that shift in behavior and mindset also. So I think that's just necessary sometimes, and particularly in this case.
Yeah, right. I agree. I mean, heat action right now and hoping for the OSHA regulation to come out is really hard. I think it was July 2024 when they announced the proposed rulemaking. it's a very rich document. I know you refer to the NIOSH 2016 as the Bible, which I always give it to my students as.
Oh, good for you. I'm
Yes.
glad to hear that.
But I'll say that even OSHA, when they did their proposed rulemaking, they did an amazing job summarizing the science behind the regulation. It's about 700 pages of work by the federal workers that they did a great job in doing this. But now that, I mean, it doesn't seem likely that it's going to pass. So we can look at states, but there are only 22 states with OSHA plans.
Yeah.
So there are states that do not have OSHA plans. That becomes a problem because you're not going to have the infrastructure that Bruce relied on to get the Maryland or the Nevada or others. But I also want to highlight local government. And the Miami-Dade County, for example, they're showing great leadership in that. They have a chief heat officer that is designated in Miami Heat,
great.
and that's their team in Miami-Dade County. So that's one way we can show leadership. And from academia and from research, we can help find what are the arguments against. Bruce mentioned there's about 50,000 comments for and against the OSHA proposed rulemaking. And many of them are science questions that we can help answer. And some of them were the productivity questions, which I think we have solid data that shows that heat action will improve productivity. It is good for the economy to have heat regulations. It is not against that. We can improve it. So at different levels, starting from the federal, hoping that this could happen, even if it's a miracle, and then at state level, and then local, and also partnerships with nonprofits and partnerships with academia to answer research questions.
Thank you all.
I'm sorry, go ahead.
I was going to ask an additional question. So did you want to add something quickly, Bruce?
Just the fact that, as you mentioned, the preamble to the standard is really well done. It bases it on a lot of research, and it is lengthy. And that's what others who hate standards say, look at this thing, there's 800 pages of complete nonsense. And we really have to push back on that. The preambles to OSHA standards are great scientific documents for the most part. And the standards come in under the cost of the estimates quite often, as opposed to industry says, it's just going to close us down. That's what the lead industry said. We'll be done. That's it. Can't put the standard in effect. So I'm sorry, go ahead. Didn't mean to.
Oh, that was a welcome addition. Talking a little bit about how we can scale and sustain some of the solutions. I think in Meghan's presentation, she talked about this innovative homemade air filter. And as she was talking about it, I was like, wow, we need to get this on videos, on shorts, all over the place so that folks are really thinking about tangible solutions for what they can do and what can be scaled. So what are some key ingredients for scaling some of the successful heat adaptation strategies, the research-driven insights, and also ways that we can inform policy change at you all are saying at the state level and local levels, and in cities and regions across our country that really prioritize and build resilience for our most vulnerable, as well as our whole entire society as a whole.
Yeah. So thanks, Rebecca. I think about this a lot, and how can we scale our work? We have a cohort of workers, probably about 70 or 80 workers based in Nicaragua. And we work very closely with the farm, with the mill, and all the employers there. And great work and great collaboration. But how do you take this to the next level? And that's the kind of question that I keep asking myself. And I think we should not, in research, we should not shy away from partnerships with industry. In some aspects, especially if we're going in and showing them that actually the heat measures that we're doing is going to help push the industry forward. I have a lot of conversations with people in construction, and they keep telling me, "Oh, we're missing our deadlines." I mean, construction always misses their deadlines. I mean, when have you ever seen a house or a building just built slightly on time? But that's not my argument, though.
Okay.
I'm saying we can show that with partnership with leaders and visionary leaders in the industry that want to do the right thing, we're able to help. And we're hoping that we could do this with money from the NIH, for example, to do federal grants, so that we're not funded by the industry, but we're working with the industry. Now that's evaporated, so we'll have to find ways to get funding. Foundations are a great ways that can help scale our work, and also philanthropy and many other sources of funding. But I also want to highlight that this is not an issue that's confined in the US. In the Middle East, where I come from, it's one of the hottest areas in the world, and we got migrant workers, some of them documented, some of them are undocumented, and they don't have the power differential to tell their bosses that, yeah, we think it's too hot, we're going to stop, because they fear the risk of deportation. So you get also these social layers that adds to their vulnerability, to their health vulnerability. And also we see the same examples here in California and also in Florida and many of the farms, that we have undocumented immigrants working in farms, and they don't have the ability to speak up because they worry from some abusive bosses that they're going to tell them, well, if you're not going to work, I'm going to report you. And what a hostile environment that it is right now for that. So what do? You work yourself until you're overheated. Mm-hmm. And then we see tragedies like the one that you showed. And it is very common, and it is undocumented.
Yeah, good point. I would also like to plug for capitalism.
I wasn't.
You know, you hear so much about regulations being horrible, but in fact, regulations can drive innovation, and companies jump on board sometimes to develop the technology, to control technologies, to make it safer for workers. I've done a lot of time wearing respirators. They're awful. They're just very unpleasant. And so higher engineering controls are possible. And when we put the silica standard into effect, which not that long ago, there was a table that said you could use these control devices to control the exposure to silica and not have to deal with much else. Just get these control devices. And companies sprung up to start designing ventilation systems and wet methods that work. So it can be a very potent force for that.
My answer is just pretty much always going to be with the people. So making it, continuing to have the education be something that is enjoyable, and kind of interweaving it with events and kind of like fun things, because sometimes heavy information can be too much when you're constantly going to a community meeting and you're reliving tragic events or talking about things that are difficult, or something like that. So just kind of always parsing in education and everything that we do, whether it's like a community dinner or, like I said, the ice cream socials and things like that, and just making sure to always leave bits of information there. People will start sharing that with the people that they know, and it'll just kind of like build on itself.
Thank you so much. This last question that I'll ask, and I'll ask that you all respond in a minute and a half so that we can get to at least one audience question before we close out. How can we ensure that solutions to extreme heat, whether through policy, research, or community action, center the needs of frontline workers and historically marginalized communities? And let's go in the reverse order of how you just answered. So let's start with Meghan.
I couldn't hear very well, but I heard part of the question, which is how do we
How do
work
we ensure
on
the
climate change?
solutions to extreme heat, whether they're through policy, research, or community action, center the needs of frontline workers and historically marginalized communities?
Yes,
Um,
I work very closely with migrant workers, and the problems when I start to talk about heat, it quickly, the conversation goes that this is not my main concern. For many of the migrant workers, they worry about their access to healthcare to start with. They worry about wages. They worry about sending money to their families. So there are many issues that, unfortunately, and if you look, I tried to conceptualize this, and it is just like shaving layers of someone's health. And you think of it from the individual level, from the community level, and also from the workplace. So there's many stressors on their lives that we usually say in public health, and we teach this, is that the workers are healthier than the general public. That's what we always say. But why do we see young and otherwise healthy individuals now showing up to hospitals? Because there are issues that go beyond the workplace to the community, into the social vulnerability that they have. So I don't think there is one magic wand or one solution that fits everything, at least for the work that I was doing with migrant workers. And I still continue to try to find ways that we can improve and add solutions along the way of the journey of migration. And with climate change, we're going to see more migration.
Yeah.
We are going to see more migration and climate change. So the problem is only going to get bigger.
I would just like to say, well, I work with construction workers, and you mentioned, Barrak, that there are monitors you can wear on your body, physiological monitors now that make a huge difference. We usually measure environmental conditions, but quite frankly, a colleague of mine looked at this out west and said, our environmental measurements don't cut it compared to actually wearing a physiological monitor that alarms when it's, parameters are exceeded. So I hope we can push more of that and get more cheaper technologies out there that make a difference.
So something that we use is called the neighborhood's first engagement model. So it does work a little bit easier and clearer when you're looking for like certain changes or things that you want to see implemented in your neighborhood. I think when it comes to health, we would obviously want to continue using the neighborhood's first engagement model, but also partner that with healthcare professional data and kind of help so it can provide insights. And that will help us to continue to make sure that we are addressing the people and what they need most, but also making sure that the information and choices are informed.
So we have some questions. Thank you all so much. We have some questions from our audience. And one of them, this one is for Meghan. Are any of the Detroit resilience hubs open 24/7? How do you help with heat protection on hot nights?
Okay, so right now, I don't think none of them are open as far as the ones that we started, or not started, I should say, but are helping to host 24/7, but they are available on an emergency basis. So because these hub leaders are like people from the neighborhood, grassroots organizers. So if they're needed, there's a phone number listed. You can call them, and they are really like about that. So they will help and be available. Unfortunately, nighttime, high heat, that's probably so heat is something that we are severely ignorant on still, and the nighttime sustained high heat is something that's even worse. A lot of people don't even know that that's a thing. So no, unfortunately, right now it's not. This past summer, 2023, was really our first summer really working to try to push heat education as like a sustained issue. And now it is kind of at the forefront of our work. So hopefully one day, but not right now. But we are working on that. Thank you for that question.
Thank you. And with our minute we have left, our last question is, how do you ensure that the increased productivity from extreme heat protections does not mean lower wages for workers and higher profits for employers?
Absolutely. This is one of the key questions that were discussed, and it is also discussed in lengths in the OSHA proposal. Remember, OSHA is required by the Supreme Court in previous decision that they have to show economic feasibility. So it is there. It shows how employers would actually pay for the rest breaks. So that is included as part of their pay. So it's not like, oh, you worked 4.7 hours out of the 8 they were supposed, so I'm going to only pay you for these 4.7 hours. That is wage theft. So there would be coverage by the employer of the rest breaks, and that is how the model works, and the employers would benefit.
Thank you all so much. And this has been a very informative and impactful session. Thank you to our panelists, Barrak, Bruce, and Meghan. And thank you to our audience. And your questions that you've asked, please make sure to reach out to our panelists with their contact information. And we open for you all to continue to engage with this at every level, state, local, and federal, in terms of pushing policy and also activation for engagement. Thank you all.